cold outside.
Yeah, although it's going to get nice, so we're glad. I appreciate you guys coming. Sometimes we've got large groups, sometimes small. Quite honestly, I like small groups because then we can make it more interactive and we can talk to each other instead of at each other. I do these workshops periodically every few months, not only to educate, but to keep people engaged in their own health. You can hear something once, you can hear something twice, and as you hear it more, hopefully it starts to fit in with what your paradigm is, the way you want to lead your life. My background, I think anybody that's heard me speak before, I've been a chiropractor for 18 years. For most of the first 10 years or so, I was mainly a pain-based doctor, meaning if you came in with back pain, I treated your back, and after a few weeks, pain was gone, you leave, and then a few weeks later, most likely, you were coming back with the exact same problem. And that started to lead me to not be satisfied with what I was doing, because I really wasn't making a difference in people's lives. And thankfully, the research and a lot of the information coming out right now is leading me in a direction that a lot of people are going in, which is brain-based healthcare. And we say brain-based is because the brain controls everything that we do. Okay, in our body, there's basically 3 different types of tissues. Ones that are active, ones that are passive, and ones that are controlled. So passive is bones. Bones don't do anything unless muscles move them. Okay? Muscles are active. Come on in. Oh my God. Please take a seat. Muscles are active. They contract and they pull the bone or whatever the joint is that they're trying to move. But muscles don't do anything unless they're told to. Right? So then there's the control system. And the control system is the brain. But it's interesting, even with the brain, we're finding out information can travel both ways. They have now found that the heart has a little nervous system, a little brain of its own, and there is a ton of information going heart up to brain. They've now found out that the gut has its own brain, and it has many neural fibers in there that are controlling processes, just like the brain would. And there's a lot of information being sent back up. So there's many different centers of control, but for tonight's purposes, we're going to call it the brain and nervous system, and it's a communication highway that's going back and forth. But the purpose of tonight is not only to educate, but it's for you to question some of the beliefs you've had. If you look at the medical model that we're currently under, it's flawed, as any model is. But the main medical model that we base almost all of our medicine on is called the germ theory. Right? We've all heard of the germ theory?
No.
Does anybody here know what the germ theory is? Okay. The germ theory is there is something bad outside of us that comes inside of us and causes some type of ill health. The germ. Bacteria, viruses, some external thing that comes in us, and then the medical profession has found medications and cures to get rid of these germs. But this doesn't hold, because what a germ is a scavenger. Okay? Germs are scavengers, and they go to places where there is tissue that they can scavenge. So the analogy that I liked, and it makes me laugh, but it also really holds true. Imagine yourself going to a farm and seeing a big pile of manure, and there were flies all over that manure. Would you come to the conclusion that the flies created the manure? Sounds ridiculous, right? But that's exactly what the germ theory is. They swab your throat and they say, oh, there's streptococcus here, or there's staphylococcus, or whatever the virus or the bacteria is. You're sick. That bacteria must have caused it. It's not the case. Bacteria are scavengers. They go to areas to eat up diseased and damaged tissues. If the germ theory was accurate, then every time you were exposed to someone who had a cold, every person that's exposed would get sick. But they don't. And the reason they don't is because the only people that get sick is when your nervous system and your immune system are stressed enough that your body allows it to take over. There was an amazing author, his name is Bruce Lipton. Okay? He wrote a book called The Biology of Belief. Everybody should read this book. But he was part of a team that coined the term epigenetics. You see, Bruce Lipton was really important to us because he was a Stanford-trained biologist. He was very, very well respected, and he was one of the leaders of the team to decode the DNA. You may have heard of this in the 1980s. They basically thought we had millions of genes and that they were going to decode this entire thing and see how superior humans were to all of these lower life forms. Wasn't what happened. Essentially what they found out is we do not have that many more genes than monkeys or many other type of life forms. So as they were doing this decoding of the DNA, they would strip the DNA of a layer. That layer was made of protein. They would strip it and literally throw it in the garbage and then start decoding the DNA. There's the blue eye gene, there's the tall gene, the short gene, the breast cancer gene, the liver problem gene, the kidney problem gene. They just kept listing it. And after several years they said, we've solved it, we've gotten every gene. But what they found was these genes could only be activated if the protein opened up a doorway so that that gene would be exposed. So if you have the breast cancer gene and that door stays shut, you don't get breast cancer, you don't get blue eyes, you don't get liver disease, you don't get heart disease. That door has to be open. So they literally went back to the drawing board and said, what opens the doors of these proteins? So they had to start from scratch again and start doing all their research. And what they found was it's external factors, stress, that opens up these doors. It could be physical, it could be chemical, it could be emotional. Every single type of disease, every single type of problem known to man can be brought down to one type of stress or another. Physical, chemical, emotional, electromagnetic, every one. So people will say to me, oh yeah, but it's just the weather outside. Well, the weather outside is a pressure difference, and when there's a pressure difference outside, there's a pressure difference inside. That's a physical stress, right? You couldn't name a problem that we couldn't break down and find out that it's some type of stressor. So the idea is, where do we go with this, and how do we start getting you healthier by getting your brains more balanced? So let's start at the beginning. So as we talked about, the objectives for tonight are to shift your consciousness, to have you understand this to such a great degree that you want to help the people around you. Because that's what's happened to me. As I've gone into this, I've told people about this in the past, I've dealt with anxiety since I was maybe 15, 16, 17 years old. And it's plagued me on and off throughout my life, and I've had to deal with it. So the stuff that I'm talking to is really, I consider more my life's work, my life's mission, my life's passion, because it's changed the way I function, it's changed the way my friends and family have functioned, and hopefully it's starting to change the lives of people that are in my practice, because it's a journey of how do we get our body and mind functioning as optimally as possible. Okay, people who still live by how they feel, symptoms, they're missing it. When you base your health on how you feel, it's misleading and it's dangerous. Okay, I had a friend, you know, the other day who came in and he told me about his 40-year-old cousin who just passed away of a stroke. No symptoms. Okay? I had a patient that came in today and said their ex-girlfriend back in China, mid-30s, had an aneurysm and just died. No symptoms. Well, the only symptom she had was normal headaches for years. For the last 15 years she's had regular headaches. The kind of headache when you say, how you doing? Fine, I just have my normal headache. But pain is generally your body's way of saying, pay attention to me, there's something else going on here. So when we take the medications, when we take the pills, it does make us feel better. And there is a place for it at times. But it's analogous to going home, finding that your house is on fire. You don't want to hear the fire alarm, so you take out the batteries. The fire is still raging, but at least you're not hearing the noise. And that's really what a lot of the medications do for us. So I have had times in my life I've had to take an Advil or what have you. But the idea is if you take it and think it's gone away, you're missing the point. So hopefully you will get a better understanding of this and be able to share this with people. Now I've gone through this a million times. I know you're a guest, you probably have not gone through this. Obviously the brain sits here. Anybody want to tell me what comes down from the brain? Spinal cord. The spinal cord then has nerves that go to every part of the body. It's a very, very simple, delicate system. When your brain communicates properly through these nerves to every part of the body, you're healthy. Okay? If you looked up human being in a dictionary, it says that we are self-regulating, self-healing organisms. Definition, look it up. The only reason that we don't heal and function at our best is when there's interference in this pathway. Otherwise, we heal, right? If you cut yourself, first thing you'll do is bleed, then you will clot, then you will scab, then you will scar, and you'll heal. You generally don't need treatment for that unless there's something wrong with your nervous system. And when there is, that's when problems start to arise. Our brains instruct every cell of our body to replicate perfectly. And I think you and I talked about this a little bit. If our cells replicated 100% perfectly, we would never die. Every 7 years, every cell in your body is replicated. Which means in 7 years there will not be one cell in your body that you have today. It's constantly reproducing. And if it did it 100% perfectly, we'd never die. But our processes start to break down over time due to stress, due to our environment. And instead of living to what our DNA suggests, 150, 160 years of age, the average age is, what, 80, something like that. And that's simply due to our environment and simply due to the stress that we're under. But when our brain is able to catch these things, it stops it. Right? Cancer is the inappropriate growth of cells in the wrong area of our body. And a tumor is when you have enough of those cells that are put together that are big enough to see on a microscope in the millions of cells that now they call it cancer. But everybody in this room has cells that are not replicating properly, maybe 100,000 cells. But when your brain catches it and adapts and gets rid of those cells, you don't have disease. Only when it's gotten big enough, then they can diagnose it as some disease problem. You see, when you go into the hospital or a medical establishment, if you've got a kidney problem, you're a kidney patient. If you've got a digestive problem, you're a digestive patient. But it isn't. It's the entire nervous system. And when you start looking at it from a brain level, you start seeing all the people that can be affected that never knew that they could actually be helped when they start approaching it from above, down, inside, and out. So stress, it's the most pervasive malady of our time. Up to 90% of all illness is related to stress of some kind. Right? Whether it's sitting at our desks like this, physical stress, whether it's going through a divorce, whether it's eating bad foods or having 5 coffees a day, all of this creates stress in the nervous system, and all of it causes our bodies to break down. Stress may not be felt as stress, but it may go straight to the body's weakest points. Most people come in here and think that they have a back problem or a neck problem. But I've started asking simple questions just to get them thinking. One of the questions I ask is, where do you hold your stress? 99% of people go, they intuitively know. But if I start off the conversation by saying you don't have a neck problem, you have a stress problem, they're out my door and they're going to somebody else because they don't want to hear that. They want to hear, I can fix your neck by touching your neck. Okay, today I had a patient I haven't seen in over a year. She's been on maternity leave. She came back and she came in limping like this and she could barely move. It's right here, she said. I don't know, I picked up the baby carrier and my back went on me. I put her on the table, I did some of the brain-based testing. I did one adjustment right there. She got off the table, she was like, wow, you're my savior, and she started doing a bit of a dance. I didn't touch her lower back at all. And we had to have a conversation about the connection, because this picking up, it might have set things off, but it wasn't the problem. Her body's been under so much stress that that last picking up of the baby carrier, that was it, and that was enough to set her off. So the National Institute of Health, and this was in the States because they've got a lot more research on this than we do, but chronic stress has propelled us into the early stages of the worst epidemic of all time. Life is speeding up. There is more technology, more knowledge, more things to learn, more sounds, more sights than we've ever had in the history of this planet. The kids have to learn at a greater rate. We have to be exposed to so many of these things, more and more and more. All of these things are on the rise. Heart disease, ADD, ADHD, stuttering, obsessive compulsive disorder, chronic pain, fibromyalgia. These things are growing, right? There's a lot of research being done into each of these. There's a lot of money being spent, anti-cancer, but it's not changing anything because we're going after the wrong things. Stress and how our brains deal with stress is where every aspect of our research should be going right now, because this is what is the key to unlocking the way the body heals and the way the body functions. You know, I've had kids in my office with ADD or ADHD, and they were diagnosed with this problem, and they can't even focus, they can't sit down. One of the kids I saw couldn't take a shower because he couldn't sit still long enough to get in the shower. As soon as we relaxed their nervous system, and it was an issue up here, the father came in literally within a week and said, he's taking a shower. You know, can you imagine a parent not being able to get their kid to shower, right? There's now work being done on autism. And if you look at a lot of kids with autism, they've got their heads like this all the time. And the reason is, this trapezius is more active than this, and the trapezius is innervated by a nerve that comes directly from the brain down in through here. There's a million different avenues to deal with this, but I want you to understand it all stems from understanding the way the brain works. Okay? Parkinson's, Alzheimer's, autism, insomnia, lupus, acid reflux. Okay? All of these things have to do with the way the brain is functioning. Acid reflux is an interesting one. There's something called methylation. Methylation is the body's ability to add carbons to different molecules. We don't need to get into chemistry. But methylation is the most important function for many different things, from the neurotransmitters in your brain, which are mood, digestive function, sleep, repair. Most of the body's functions need and are determined by how well we methylate. Methylation needs the acid in your stomach. But if you're not producing enough acid in your stomach because your brain is stressed, you don't produce enough carbons, you can't methylate. So now there's a whole bunch of people that are taking, you know, the, what are they called, the antacids. The symptoms for not having enough acid in your stomach are exactly the same as having too much acid in your stomach. So there's a lot of people that are taking antacids when it's really the opposite problem. They're not creating enough because their digestive system is turned off, and we're going to talk a little bit more about that. Okay, so how do you perceive stress? I guarantee you everybody in this room has some form of, you know, whether it's money or anxiety or children or work or divorce, but this is sort of typical emotional stressors. People don't think about how chemical stress affects their body. Okay, does anybody here get agitated by coffee? Okay, I do. If I have more than one coffee, sometimes even one coffee, it makes me so jittery, right? Gluten, okay, it's in so many different sauces. My girlfriend Aviva, who some of you have met, she's a holistic nutritionist, she can't eat at a lot of Chinese restaurants and places where they use all these sauces because the gluten in the sauces she reacts to. Now, if I react to caffeine or she reacts to gluten, all of us have a reaction to it, but some of us are just more severe depending on how our body's tolerance is to it. It agitates, right? I mean, we've got people out there that literally can't do anything unless they have their morning coffee. This is a nervous system disorder. I mean, you can go around the cooler at work and joke about how you need your coffee, but it's really the start of a neurological deterioration. Okay, so our nervous system is responsible for processing and filtering everything we are exposed to, and the ability of our nervous system to adapt to stress and adapt to, or be able to provide and maintain homeostasis and optimal function. This is the ability to stay healthy. Okay, so we have physical, chemical, and emotional stress affecting our brain. And I love this picture because you can see there's all of these neural connections that are going on in our brain. All of these things, physical, chemical, and emotional, affect the brain exactly the same way and force our brain to adapt. Okay, can you see? And so at any given time, if it's overwhelmed, it doesn't perform the way it should. Okay, and then what happens is you don't have the internal ability to adapt, and we develop unhealthy neurologic patterns. Okay, in chiropractic, what do we call unhealthy neurologic patterns? Subluxation. Good.
Subluxation, sorry.
A subluxation is when the vertebra move out of place or are putting undue pressure on the nervous system, and it interferes with your body's ability to heal, function, and express its life to its fullest. Slide didn't turn out. Oh, there we go. Okay. So, posture is the window to our spine, and it's the window to our brain, and it's the window to our nervous system. When you look around and see someone with perfect posture, not only are you seeing someone that probably has good muscle tone, you're looking at someone who's got very good brain function in that given moment. Okay? There was Dr. Roger Sperry. He won a Nobel Prize for doing his work on posture. And what he found was that 10% of our brain's energy goes to thinking, metabolism, immunity, and healing. 90% of our brain is to just keep us in a bipedal posture, standing on 2 feet. So thousands of years ago, our ancestors, predecessors, were on all four. This is the way we started. And then over thousands of years, we developed into a standing posture. Now look at what had to happen for that. Your hands had to rotate outwards, so that this is called posture neutral. Your ear had to come back over the shoulder. You had to be standing up straight. The hips had to actually externally rotate, right? Now, if 90% of our brain's ability goes to bipedalism, when our brain gets stressed, what happens is this. Our head sinks forward, our arms rotate in, and we start to look like this, right? This is a very common posture. Posture is a neurologic program, okay? When you are like this, and your brain is balanced, every bone in your spine is relaying messages to your brain. Right now, my cervical spine is relaying messages to my brain that everything is in its right alignment. My arms are in the right alignment, my hips are in the right alignment, everything is relaying messages. But when your brain is overwhelmed and trying to process everything, and it's stressed, it ignores some of that information. And it doesn't quite know and catch that you're starting to do this. And before you know it, your posture has changed, your head has gone forward, your arms have swooped in. And as we know, when that happens, it starts to choke your spinal cord, and it starts to go into a revolving pattern that keeps getting worse. The spine is the best reflection of brain function and the best gateway to changing and improving brain function. Okay? If we maintain proper posture, you maintain proper brain function. Disease is a contracted nervous system and spine, while healing is an expanded nervous system. Okay? So this is contraction. Everything's doing this. Okay? When you look at someone who's depressed, they're usually like that. It's very hard to be depressed when you're like this. It uplifts your mood. right? You put your shoulders back, your head over your ears, you feel good because your brain's communicating better. As soon as this happens, very easy to feel down, everything's being contracted, your organs are getting squished. Okay? This is the most common posture. Okay? Hips are forward, shoulders are back, and you're kind of like this. Now it's interesting, if you can see the feet, okay, they're rolling inwards. It's called overpronation. So one of the biggest physical stressors on our nervous system is our feet roll inwards if we don't have support for them and if our feet don't properly function. So as our feet roll inwards, what happens is it rolls the hips inwards. And as it rolls the hips inwards, it pushes the hips forwards. And as the hips go forward, the shoulders go back. Where does the head have to go to balance? Forward. We're creating this over and over and over again. All the stress we're under is starting to do this. Then our feet do this and our head wants to go forward again. We are up against it. In other words, we have a lot of forces working against us. Okay? So we have to maintain our posture. We have to maintain our nervous system. Otherwise, it just keeps getting deteriorated. Okay, fight or flight. Has anybody heard this term? Knows what it is? You got the floor. What's fight or flight?
Well, you're asking a question.
Yes.
You just asked a question.
If you heard of it, okay. Let me take us back a second. Can everybody see this chart? Okay? This circle right here. This is a cross-section of a nerve. Okay? Every nerve in your body has 3 different types of information in it. Sensory, what you feel. Motor, the instructions of how to move. Okay? Autonomic. That's your immune system, that's healing, that's digestion, that's stress. Sensory, motor, autonomic. Which is the smallest? What you feel is 10% of your nervous system. 10. Which means you don't feel 90% of your nervous system. And that's why judging your health upon your symptoms is very dangerous and misleading. These can be breaking down for years and you would never have an idea. So if you can just sort of visualize that each nerve has all 3. Let's look at this one, the autonomic, because that's the one that deals most likely with what we're talking about. The autonomic system is divided into 2. Sympathetic and parasympathetic. You won't get tested on them, I promise. But just be familiar with the terms, sympathetic and parasympathetic. Sympathetic is stress. Heart rate goes up. Okay? Pupils dilate. Okay? Stress, stress, stress. That's sympathetic. Parasympathetic is just the opposite. Relaxation, healing, digestive function, all of the things that you need your body to do when it's nice and calm. So you've got sympathetic and parasympathetic. I said sympathetic was stress. When your sympathetic system is stimulated, you can go into what's called a fight or flight reaction. When this was developed from an evolutionary standpoint, it was very, very necessary. If you had a bear running after you, think about all the things you would need to do. First of all, you need all the blood running to your muscles so that you could run as quick as you could away from that bear. So the blood gets shunted away from the digestive system. Digestive system shuts down, goes to your arms, goes to your legs. Okay? Your pupils dilate because you're looking for where's a safe place to go, right? You're probably sweating because you're using so much energy that your system's trying to cool itself, so it's trying to sweat, so that's why you perspire more, right? So when you're in a fight or flight reaction, you got to get out of there. And in today's society, fight or flight is okay. If you ran out and saw, your kid trapped underneath a car, you need to summon all of your energy, which there was a story about a woman in Florida who actually did this. She went out and saw her son and she picked up a car. A little woman about 5'4", she picked up a car because her immune system, her fight or flight reaction was causing her brain to get her adrenal system going, and she lifted a car. But we're in this all the time, right? Your boss yells at you, you get in a fight at work, you have too much coffee. Our body goes into fight or flight. So it's supposed to be part of the genetic wisdom that protects us, but when it goes overboard, it's no good. So your heart rate increases, your blood pressure increases, your blood sugar increases, your respiratory rate increases, okay, because you need more oxygen when you're running from a bear. Your gastrointestinal activity decreases, your sweat glands increase, and your pupils dilate. All of this is part of the fight or flight reaction. But too much fight or flight without corresponding rest is what distress is all about. You just exhaust all of the stores. It was meant to be a 10 or 15 minute thing. Not a whole day, not a whole week, not a whole month, not month after month after month of stress and fight or flight. So during fight or flight, our adrenal glands go into overdrive, and they produce adrenaline and cortisol. Your adrenal glands are on top of your kidneys, and they produce these chemicals. Adrenaline is what produces that surge of energy, but cortisol is a catabolic hormone. It breaks down muscle, breaks down bone. It's why people can't lose weight, because it stores fat, right? You want to store fat just in case that bear traps you in a cave. So you could be eating a good diet and doing lots of exercise, but you're not losing weight. It's because your body is stressed and it's producing too much cortisol, which is layering it all on, right? So signs of adrenal exhaustion. Inability to tolerate much exercise. It just exhausts you more and it throws your anxiety up. Feeling worse after exercising. Water retention. Symptoms of low blood sugar. The need for caffeine, as we talked about, to keep you awake. Sweet and salty cravings and the ability to relieve depression by eating. So these are all very typical signs that your adrenals need replenishing. Your cortisol levels increase. So when you anticipate a stressful or exciting event, like a roller coaster, or you're concentrating too hard on a deadline, or exercising for more than 40 minutes. So there was some interesting research that just came out in the United States. I might have my numbers off just by a little bit, but I believe what I heard is that anybody who does more than 50 kilometers, or maybe it's 50 miles, per week of running, has no better health, no better heart function than someone who's a couch potato. In other words, somewhere in the middle, you're doing a good job. But when you're one of those marathon runners that's doing it all the time, think about the physical stress that you're putting on your body. You're releasing cortisol, which breaks down your muscles, breaks down your bone, leads to more inflammation in the body, leads to heart disease. So when you think you're doing, like marathon runners and triathletes, they're good athletes, but they're not always healthy. I worked at a place that only did triathletes, and these people could do amazing things, but these were not healthy people. They just had goals that they were driven by. So during fight or flight, your stress hormones signal non-essential functions to shut down. Your immune system is not essential when you're running away from a bear, so it shuts down. That's why when we get stressed out, we get a cold. So as soon as someone comes in here and they say, I didn't come last week because I was sick, I said, well, that's when I want to see you the most. Your nervous system needs a boost. When you're sick, it's because your body's under stress. And when your body's under stress, you need to reset your nervous system and stimulate your brain to function better. Okay, so sympathetic survival syndrome. The sympathetic system, fight or flight, is for survival. It wasn't meant for an everyday thing. But the more the research is coming out, it's showing that our brains don't know how to distinguish from what's real or what your brain perceives as real. So, watching the news, reading the newspaper, watching disaster movies, your brain can't distinguish between seeing a tsunami in Japan and thousands of people dying, between you being there or not. You're watching it, you're intaking the stimuli, right? We have to adapt every day when we go outside to all the sounds, all the lights, all the wires, all the computers, and then we read the news or we have something go on at home. It's just too much. and we're on overwhelm. And it's not just one of us, it's all of us. And we all have electromagnetic fields around us. When those electromagnetic fields are stressed out, it spreads to other people. Have you ever said to someone, when that person comes in a room, I don't like their energy, or I get stressed just by seeing certain people? We all feel it. It's because our electromagnetic fields are all around us, and it's spreading. And as a society, we are getting more and more stressed out. We all need to stop, take a breath, and then refigure out how to live in this community without being under such timelines, such stress, such anxiety. Okay, so I want to do a couple of things. First of all, I want you all to just stare at this for a minute. Who sees her spinning clockwise? Okay. Who sees her spinning counterclockwise? Okay. It's sort of an illusion. If you're using more of your right brain, she spins counterclockwise. If you're using more of your left brain, she spins more clockwise. If you can see her switching back and forth, you have a much better ability to adapt between your right and left brain, and your brain is much more easily balanced. Okay, can anybody see her going back and forth? Yeah?
It's so weird because
Like up and down?
Well, she is going up and down, but you see, I'm seeing her spin this way. But I know at times I can actually see her going the other way.
Oh, now I see what you
Did I switch for you? Yeah, I'll give you another one. I want, there's a little bit of space here.
So this is saying I've only got half a brain, is that right?
It's one that,
Like the Tin Man?
it's showing that one side is really over-dominating the next. And we all know left brain is supposed to be more logic, more reasoning. Right brain is supposed to be more creative, more languages. But there's a lot of crossovers. But we should be able to use both sides. So is everybody here right-handed? Is there any left-handed? Are you left-handed? Okay, me too. So what I want you to do, stand up for a minute, so we'll get a little bit too. Okay, what I want you to do is, if you're left-handed, you're going to use your left hand. If you're right-handed, you're going to use your right hand. What I want you to do is, first you're going to start with your foot. Now, if you're right-handed, I want you to start going clockwise with your foot, making a circle.
Right or left?
If you're right-handed, use your right foot. I want you to just go make a circle.
I'll move your chair a bit, okay?
Sure.
Yeah.
Okay.
Let me know if it's there when I sit down.
So just start going with the right. Now, you can't be holding on. We can't do cheating here. Okay, our foot's going in a circle. Now, what I want you to do is, with your drawing hand, I want you to write your name in the air while keeping the circle going. Okay. Challenging, right?
Yes.
Okay. Who stopped doing the circle with their foot, and who couldn't write their name? What were you doing?
Opening the door after cutting
Was it harder to keep the foot going or the arm? Okay.
Yeah, I just stopped the foot and I just...
You went right to the writing.
It's foot and then a jag.
Okay, you stopped the foot first?
Yeah.
Okay.
Same.
Same?
Yes, stop the foot to right, yeah.
Well, I forgot my name, so I couldn't. I stopped both.
Right, but that's what happens. Because your brain is being
Yeah, really.
challenged. Left brain, right brain. Okay? Most of the time your foot just starts going any which way, and I remember the first time I did it, I just couldn't write. I forgot what am I doing here, right? It's just your brain is trying to adapt in all situations. This is brain challenge. Your brain is just under stress and now trying to do both things it can. Right? Okay, you can sit. But I think
Which way is she spinning?
depends upon which way you look at it.
I'm going to put your chair
No, thanks.
the way it was.
It depends on the way you look at it. She's spinning both ways. It's an illusion.
But she actually does change.
Yeah, now she's sort of like...
She doesn't change at all. Nothing changes here. The only thing that's changing is in your brain. This is just an illusion.
My left brain. Oh!
But now she's turning clockwise before
No,
she
she
was
hasn't changed for
turning
me.
like counter.
She's still going right for me.
Interesting, right? It's just your brain's perception.
Are you sure?
I'm 100% positive.
How is it? Optic?
It's an optical illusion, essentially. Okay? But, you know, it doesn't say, this is not a diagnostic test, but I use it to show you, with the other test, we're constantly under brain challenge. So, circumstances don't determine our level of stress. It's our thoughts and actions that control the amount of stress that we experience in our lives. Right? Most people, it's always the external that has caused them to be stressed. We all have external stressors, but it's the way that you perceive them and adapt to them. There's so many things in my life that I'll go home and I'll say, I can't believe how stressful that was. And someone else will say to me, or my partner will say to me, well, just look at it like this, that's not such a big deal. And then I'll hear someone else say, they are so stressed out by whatever it is, and I can see, for me, that wouldn't have stressed me out. It's all your perception. We always have choices, we always have things that we can do to get around it. You know, I always, if you're ever wanting to sort of make yourself feel, I guess, better about your circumstances, you do things like watch, you know, a video of someone starving in Africa, or go visit a hospital where there's kids suffering of cancer. And it always blows my mind when you see people in the worst circumstances and they're smiling and laughing. And the idea is that they've found a way to change their perception of the events. And if all of us could just change our perceptions of the events and live just today, we'd be a lot less stressed. So there's 3 secrets, and those of you who've seen my talk before, this is a repeat, but I want to go through it again. There's 3 secrets to eliminating stress, or at least balancing it as much as you can. The first is make sure your brain and nervous system are functioning properly. I don't care if you take medication, you're on a diet, you do exercise, none of it will work properly if your brain is not balanced. It just won't. Okay? We see it over and over and over again in this clinic. People who get chronic infections, chronic colds, blood pressure is high, back pain, neck pain, knee pain. Until your nervous system is balanced, none of the other things will work. So this is why I do what I do. Okay? I don't do these lectures because I just want people to come and start care with me. I do them because this is me. This is what has saved my life. This is what has changed who I am. I feel like this has to be shared with people. You're never going to hear on the news, go to a brain-based chiropractor and you know, get your health on track. There's no money to be made, and I don't have $1 million to go out and spend on these ads. Okay, if it's not the pharmaceutical industry or people with deep pockets, you're not going to hear about it, right? What I ask people to do is change their perception. Dentists have done a brilliant job. If you think about it, 100 years ago, 200 years ago, people saw dentists because they were rotting. Somewhere in the last 100 years, they've educated the public to say, do not let your teeth rot. Come see us every 6 months or a year or whatever it is. And now the average 4-year-old knows that they go to a dentist. Right? My kids have grown up knowing they can get adjusted, and as soon as they have a problem, they need to get adjusted. Okay, I remember my son, he was about 4 maybe, and he walked into the room and he was feverish and he was kind of yellow and he was like this and he had just no life in him. And I put him down on my table and I adjusted him. And his fever didn't go away immediately, but the color in his skin was different almost instantaneously. He got up off the table and he took my hand and he wanted to go play. And it was in that moment I realized how powerful it is when your nervous system is getting blocked and when you need to get the life back in you. I saw life come right back into my son. And both of my kids were adjusted literally on the table that they were born on. Not because they had anything wrong. I wanted to make sure that the birthing process, which can be physically damaging, was not damaging their nervous system, right? What's sudden infant death syndrome caused by? What's colic caused by? What are some of these disorders that have started since birth caused by? If you've ever watched a live birth, you can have your spinal cord stretched and twisted, and they haven't done anything wrong. It's just part of what they have to do to get the baby out of the birth canal. My daughter came out like this, and her nose was bruised, and I took her to a specialist last week because she's had chronic sinus problems. And being her dad, I've adjusted her almost all the time, but it's tough to deal with family, and so I finally just wanted her to go see someone else that could look at it with different eyes. And literally with 2 adjustments, her sinus problem cleared up. 9 years. I mean, it's just incredible. So I still see these things that people call miracles every day. I don't call them miracles anymore. I just call them, understanding the way the nervous system works. So secret number 2, this is an exercise I really encourage you to do at home. First of all, identify all of your incoming and past stress. If your list is anything less than 200 things long, you're not really doing this exercise. Every physical stressor that you've been under in the past or are under now. Every chemical stressor you've been under or are under now, and every emotional stressor. It could take you a week or a month or whatever, do this in small chunks, but list everything, put them in orders, whatever you want to do. You don't know what you have to approach until you've actually listed it. And then reduce or eliminate. You could probably group things into 20 or 30, the similar kind of things. You fell off a bicycle when you were 8, you had a car accident when you were 14, you fell off a diving board. These are all physical traumas, so put them in the physical trauma section, right? But then you can start to make a plan for each one. Most of us don't do this with our lives. We don't have a plan. Well, how are you ever supposed to fix something if you don't have a plan? And then secret 3 is increase your capacity to deal with stress. So in some of my lectures I'll deal with exercise, nutrition, mindfulness, Lumosity. Has anybody heard of Lumosity? Lumosity is all around us. It's Brain Games. It's a company, you can Google it. I'm a member. It costs $60 a year or something for a whole family. But it's brain games. It's not going to cure you of anything, but what it's going to do is keep your brain active in all different sorts of ways. Problem solving, memory, spatial capacity. The idea is what they're showing now is the more active you keep your brain, the more unlikely it is that you're going to have some type of neurodegenerative issue like Parkinson's, like Alzheimer's. So Lumosity is just brain games to keep yourself going. But the 2 I want to talk about tonight are MindFit and Heartmath. MindFit, some of you have tried and done some of the programs. Depending on how long you've had stress, depending on what your issue is, it can take anywhere from 3 months to 6 months to really balance your brain. But what MindFit is it's called entrainment. It starts to relax your brainwaves. So, before we go on, I need to explain brainwaves. Okay, so tonight we've talked about a bunch of things. Brain, spinal cord, and nerves. We've talked about the autonomic system. It's divided into sympathetic and parasympathetic. But everything in our body has a frequency and a rhythm to it. Everything in our environment has a vibrational frequency and is vibrating. Our body is no different. So our brain has different frequencies, and those frequencies determine function and determine the messages that are being sent to the body. So in our brain, there are 4 basic wavelengths that we're concerned with today. Beta, alpha, theta, and delta. Okay? Okay. Beta, alpha, theta, and then delta is even deeper. Beta is normal waking state. Most of us right now are just in beta. Okay? The highest form of beta, which is above 13 hertz, 13, 14 hertz, that's stress. That's fight or flight. That's when our body is overwhelmed. Alpha is when our body is relaxed, when it's starting to get creative, when you're reading a book. Hypnotism, that's all alpha. So when people say they can't be hypnotized, we all can be hypnotized. All it means is that you've been put in an alpha state. When you're in an alpha state, you're more susceptible to change, you're more susceptible to people telling you what to do. So some of us can, you know, bark like a dog if we're hypnotized, but we can all go into an alpha state. We all do every day. Theta is sleep, and then delta is deep sleep. Sorry, theta is dream state. You're sleeping, but you're dreaming. Delta is deep sleep. So we've got beta, alpha, theta, and delta. Now, when we're in a waking state, we're generally in beta. When we go to sleep at night, our brains are supposed to go beta, alpha, theta, delta, and then as we're sleeping, it should go alpha, theta, delta, alpha, theta, delta. And these are the normal rhythms throughout the night. That is your brain's ability to unwind, to process things, to heal. But most of us are so stuck in that fight or flight stress response, we stay in beta, we go right to delta, we don't go into alpha, we don't go into theta, and we wake up in the morning. I don't care if you've had 4 hours or 10 hours, you're exhausted. And then you say, I need more sleep. But you don't need more sleep, you need more restful sleep. Okay? There's a lot of people that say, oh, I don't have insomnia, I sleep 8 hours, 9 hours, 10 hours. But they're exhausted. It's the exhaustion part. You're not recharging, and if you're not recharging, it has to do with the way your brain is able to relax. And when it's stuck in a hardwired pattern, beta, stress, your body's not relaxing, it's not healing, it's not regenerating. So what this technology of the MindFit is, it's not so much to give you more alpha and more theta, it's to allow your brain to smoothly transition between beta, alpha, theta, and delta, and it can circle back and allow your brain to do that. So any of you that have tried it know that generally you're going to sometimes drift off, sometimes you fall asleep. You know, there's 4 things that it involves: sound, music, spoken word, and flashing lights. All with the purpose of stimulating your brain to relax it and put it into a more balanced state. The reason I've introduced this into the clinic is because I want people to get quicker reactions. I want to start being able to help people who never thought they could be helped before with weight loss, with digestive issues, with sleep problems. But it all comes back to the way your brain is functioning. You know, the cool thing about what I do now is I got into chiropractic for completely different reasons that I'm in it right now. But if any of you have had experience with other chiropractors, there's 50, 100 different ways to adjust. There's people who say I'm very gentle, people that say I'm very hard, people that say I don't like this kind of adjusting, I don't like that kind of adjusting, that looks dangerous, that doesn't. The one thing common with all adjustments is that they stimulate your nervous system, and it's like pressing Control-Alt-Delete on your computer. It resets the system. And that's why no matter what technique you use, no matter which one is being used on you, your body will at least reset itself. But the reason that some don't work is because there are different states of your nervous system. Some people are over-aroused. Some people are under-aroused. Some people are exhausted. Some people are unstable. Right? So if someone's system is over-aroused and I adjust everything on their body, it's too much arousal. And they go, geez, now I'm worse and my back is killing me. But if someone comes in under-aroused, their nervous system needs to be woken up. If I just do a gentle adjustment with them, they're not going to get any benefit. So when you're looking at what to do for each person, you have to take into account how is their nervous system. Sometimes I think some of you will have noticed I've done more. Sometimes I do less. Sometimes I'll adjust 8 different areas. Sometimes I'll adjust 2 different areas. It's not because I want to be lazy one day and more aggressive another. It's because the way your nervous system is functioning in any given day may change, and you can't do the same thing every time. Otherwise, you might make it worse. So this is, again, just showing how the frequencies change to bring you more into an alpha or theta rhythm. Okay, so light and sound technology provides stimulation that causes the brain to release the chemicals associated with pleasure, learning, memory, and creativity. It helps to quickly put you into a receptive learning state, and it shows that it increases neurochemicals in the brain. So the purpose is to start to balance the brain, and what they showed, this is way back in 1990, this is when a lot of this research started coming out. It's improved by far now, but even then, there was an 11% increase in norepinephrine levels when using the MindFit. Norepinephrine keeps you awake, okay? 21% increase in serotonin levels. Serotonin is the happy chemicals, right? 25% increase in beta endorphin levels. That's killing pain. So when your brain is more balanced, when your brain is stimulated, you have more energy, you're happier, and your pain is decreased. Okay? I know that the pharmaceutical industry has come up with all kinds of different medications for depression, for anxiety, for all these things. There are times where you need an acute help. You need a break. You need relief. And I get that. But if you look at the science behind it, first of all, there's not a lot of good science behind any of this. Most of it was trial and error. They found out that it worked for certain conditions because they just said try it. Right? And then it's, oh, it worked for that? Okay, we'll use it for that. But it's very interesting to me. If you look at most of the antidepressants, they're called serotonin uptake inhibitors. What that means is it doesn't allow the brain to get rid of the serotonin that's there. Because you're not creating enough serotonin, the theory is keep whatever serotonin you have in the brain longer. Well, how many things in your fridge are better the longer you keep it there? Right? If you weren't able to get milk, is it okay to just keep that milk for several months? Right? Serotonin doesn't get better with age. It's not wine. So the premise doesn't make sense. And long term, you see people with all types of problems that now are side problems of the original problem, and you get so lost in the spiral of what the issue is, you're kind of caught. And then you're ending up taking another medication to, So my advice to people is, I don't want people to suffer. If you have to do something on a short-term basis while you learn some of the other techniques, while you get your life in order, while you take things into your own control, there's no judgment. You've got to do what you have to do. But as a long-term option, for many people, it's not the long-term option. Okay, obviously this is to be discussed with your doctor and to make sure that the right advice is given to you personally. But I've seen too many people go down that treadmill of they just get stuck on the medications and their life is not really turning around other than now that they're stuck on the medications. So other things that they've seen: improved vision, accelerated learning, balanced brain hemispheres, normalized blood pressure, lifted mood, stabilized emotions. Okay, these are all just products of having a more balanced brain. It only makes sense. So what the programs that we're doing here, they are to imprint new patterns in your brain. So the ones that we've been promoting, the weight loss, the chronic pain, the stress, insomnia, digestive problems, but they have 500 different programs. And the reason that they're all good is because you don't have to have a massive disease process to use this type of technology. It's brainwave entrainment. And I think you'll see this more and more as you look around. It was funny today, I was just on a website, a sports website, and they were advertising something called Muse. I'd never heard of Muse until a few weeks ago. One of my patients introduced me to Muse. It's a headband that you wear, and you have Bluetooth hooked up to a video screen, and the idea is that it's neurofeedback. You want to keep the screen looking like a bright sunny day, but when your mind wanders to stressful thoughts, a storm approaches. And the idea is that you're training yourself to keep the nice sunny day there. So this is more of a toy. In other words, if you're going to do real neurofeedback, it actually costs several $100s per session. It might cost 40 sessions. You might spend $8,000 to $10,000, but you're really retraining your brain. Okay, I have a friend that does neurofeedback, and it's absolutely fascinating. So this is kind of a toy, but this is now what's coming into the public consciousness, which is great, because if we can all start learning to control the way our brains function, we're all going to be much, much healthier, right? The other thing I wanted to talk about, some of you have done, who here has done the HRV, the Heartmath, where we hooked it up to your ear? I know we did it. I never did it with you. Have you ever, do you know what heart rate variability is? Okay. When you look at someone's heart function, there's generally three things that we look for. One is heart rate, one is blood pressure, one is heart rate variability, HRV. So as we talked about, when you're in a stress response, your heart rate goes up, your blood pressure goes up, right? Heart rate variability is your body's ability to get stressed and calm. So when you breathe in through your nose, you're stimulating the stress response. And then when you breathe out through your mouth, you're activating the parasympathetics, the relaxation. So it's the balance between the two. If you can get your heart rate variability into what's called a sine wave, nice and rhythmic, that's called coherence. And when you have a coherent heart rhythm, it takes over the rest of your body's rhythms. Everything in your body has a rhythm to it, but the most potent, or the most common ones we talk about, are our breathing, our digestive, and our brain. There's frequencies and rhythms to them. And the heart's rhythm is far bigger, far stronger than any other rhythm in the body. So if you can normalize your heart rhythm, you will entrain all of the other rhythms in the body to your heart. That's what entrainment is. Like one big wave takes over a smaller wave. Or if you've ever had two tuning forks, they eventually buzz at the same level as the biggest tuning fork. Or if you've ever walked in a clock store, most of them are synchronized to the biggest clock in the store. That's entrainment. It's all about frequencies. If you can do that with your heart, it can literally change your entire physiology. And the company Heartmath is now doing some research on how you can change the planet. And it's a pretty cool story, but what they found to do some of this original research was on September 11th, 2001, when the planes hit the buildings in New York, the Earth's electromagnetic field blipped. There was a spike at the same rhythm as a heart. And what they found was there were millions and millions of people with the same emotion looking at their TV screens. And that was enough to make a spike in the Earth's electromagnetic field. So the theory that Heartmath is now working on and studying and putting millions of dollars of research in is if we had enough people on this planet holding the feeling of love in their heart, that you could literally affect the Earth's electromagnetic field and save the planet. It's a pretty cool theory, because every religion on Earth has literally been saying that we're all one, right? And now they're actually trying to prove it.
I think I told you that that spike on 9/11 actually started 10 hours before the planes hit the
Right.
top.
And this is
What? How did that happen?
this is all space-time continuum. This is a little bit off topic, but there's a book called The Intention Experiment. And what they did is they had all kinds of different experiments. And one of the experiments is that they had a wire set up in Times Square in New York. And every time someone walked past it, it would record it. And what they wanted to see was if someone's intention could change the past. So what they did is they had recordings of, I guess at the time, I don't remember if it was on CD or VHS or something, but they had all of these tapes, and they divided them into, some people wanted to see, it was future, I might be getting this wrong, but it's future, present, and past. So that all of these tapes were put in separate locations. And on one set of tapes, if let's say the mean was 10,000 footprints an hour, I'm just making that up, they wanted to see if they could make a statistical difference by people having their intention on those tapes. So what they found was, let's say 10,000 was the mean, and they would think it was statistically significant if it was plus or minus 5,000, whatever their numbers were. They had a group of people basically focus on these tapes and say we want it to be whatever the lower amount was, 2,000 or whatever it was. And they just had their intention on it. And basically when they opened up and they did the results of all of these tapes, all of the other ones reached the mean, and only the ones that they thought about being less were less. In other words, they changed what had already happened. So it's kind of, what is time continuum and it's a pretty confusing thing. But this book is amazing. It's called The Intention Experiment, and they do all kinds of different things. They figured out that plants communicate because they had these plants and they were putting these lie detector things on these plants, and they had a plant in one room, and then all of a sudden somebody in way down the hallway was pouring some hot water down a drain, and all of a sudden the plants started firing off in the other room out of control. And what they theorized and then actually figured out, because they repeated it again and again, was that the algae in the sink that was being burned by the scalding hot water was communicating with that plant, and so the plant would start, recording on this machine. I mean, it's just wild. This book is great. It's called The Intention Experiment, and I would highly recommend it. But Heartmath is fascinating, and over the weekend, knowing that I was going to do this talk, I read about it, and I was getting into it again, and we were talking about stress. So I just wanted to read a couple of things here. The ventral right prefrontal cortex is associated with negative emotions and depression. It appears to play a central role in how people respond to stress. Unlike many other brain areas, this part of the prefrontal cortex remains active long after the stressful situation is gone. Your brain gets overwhelmed, and it stays overwhelmed. Another study found an exaggerated inflammatory response to stress in men with major depression. This may help explain why conditions such as heart disease, cancer, diabetes often go hand in hand with depression. In other words, we were talking about it earlier. Cortisol gets released when you're depressed because of the stress response, and then it leads to inflammation, which can lead to heart disease. You can trace so much of this back to just how our brain is dealing with stress. The reason I love Heartmath is because, again, it's like that Muse thing that I was talking about. There's equipment that I've got in the other room, and you can get for yourself fairly cheaply at home, where you're monitoring your heart rate, and you can see as your heart goes into a nice coherent rhythm. Okay? When you're experiencing positive emotions like sincere appreciation, care, joy, compassion, or love, your heart's rhythms are harmonious, created an ordered, coherent pattern that helps bring your whole body into increased harmony and coherence. When you're experiencing negative emotions like frustration, hurt, anger, anxiety, hopelessness, or depression, your heart's rhythms become disordered and chaotic, and your whole body falls into stress. Okay? In other words, simply by the way we breathe, we can change the way our heart rhythm is, we can change the way our brain's rhythm is, and then it changes the chemicals that are released that are affecting our sleep, our digestion, our muscle function, our heart function, right? So if we're looking at tools, something, in my office we get adjusted, we want to balance the brain, we want to fix the spine so that your body can be as balanced as possible. But my object is not to keep people here 2 to 3 times a week. I look at this more as needing an oil change. When your brain and body are healthy, this is something that you should be doing as just part of your health regime. But we need tools. And going home, and most of us don't do the right tools. Heartmath is something that you can have 3 to 5 minutes a day. At first I might want to practice a little bit more than that, but you can use this in any situation at any time. Okay, the MindFit is something that you can do at home. If you're anything like me, I tried to meditate for years. Meditation didn't work for me because I thought I was just failing at it. My brain kept thinking. The MindFit system is like meditation on steroids. I can't tell you how many people come in and say, I'm skeptical, or I don't buy into this stuff. And I always say to them, well, it's great, you can be skeptical of the sun, it's still going to come up tomorrow. there's nothing to be skeptical of. Whether you choose to do it or not is up to you. But if I had EEG on your brain while you were doing the MindFit, what you would see is after 3 to 4 minutes your alpha starts getting increased, and after 4 to 6 minutes you start getting more theta, and what it's doing is taking your brain waves down and up, and it's starting to synchronize your whole system. That has been shown over and over and over again. It's a matter of whether you then build upon it. You know, most people want to go into a doctor's office and say, these are my health problems. Now they're yours. You got 10 minutes to fix it, right?
Prescription.
Right, give me a prescription, I want out. Doctors really don't have to do much now in a lot of cases because they advertise on the television, right? Have you ever seen the ads? They say, please take this if you've got X disease, and then at the end there's a thing of, by the way, it can cause do-do-do-do-do-do-do-do-do, and some of it is way worse than what your actual problem is. You're like, really?
Oh, here is the medication,
You
here is
know?
the solution, ask your doctor.
Yeah. Do I really want to risk having a stroke to grow hair back? I mean, it's ridiculous. So people are now going in to the doctor saying, I'd like Prozac, or I'd like that new drug that they just came out with. And doctors are now being pressured to actually write them. So thankfully more and more medical doctors now are starting to say, no, like, that's not the first response. This is the way we're used to doing it. I always encourage people to have a health team, a health practitioner, or a health plan that is something that they just normally do. For me, it's I have to eat properly, I have to do Heartmath, I do MindFit, I get adjusted, I make sure that I don't overload myself too much, because when I do, my anxiety rages. So everybody's got to have their own plan. And so as people come in, I want, obviously you're free to speak to me about it, but make sure that you spend some time and think about what is your plan. You have to budget for it, time and money, right? But I don't think it's an answer anymore to just wait until the symptoms arise. You know, I had a conversation, I don't remember, was it with you? And I talked about, people don't like to be scared into things,
Yes.
but people, in my profession, it's very hard. If I get someone better too quickly, then they say, great, I feel great. If I don't get them better quick enough, then they say this isn't working, right? And if I see something on their x-rays or something in their brain scans or as we do testing, they may not be feeling any symptoms, and meanwhile their brain is expressing that it's stressed out. So I've got two choices. I say to them, look, this is what I recommend. I know it's kind of expensive for what you expected. You just felt like having 2 or 3 visits. I wish I could tell you that, but do what you want, and then some people go, okay, I got $500 on my insurance, I'll come for that amount, and I say, okay. Or I could say, look, you're going to die, right? If you don't take care of yourself, you're going to die earlier than you should. I'm not comfortable with either of those approaches. I don't want to be the person that scares people, and I absolutely don't want to be just sort of being ashamed to say you're in danger. But as you and I discussed, sometimes you have to take that approach. Because when I heard the other day that someone that had headaches basically dies of an aneurysm 5 years later, 10 years later, and they never took care of their health, well, someone should have told this person when they had headaches, look, you got to do something. Your brain's under stress. And if your brain's under stress, it's going to break down eventually. Right? And so more and more, as I see this, and I see the changes happening, I'm telling my truth. And you all know when I hold these workshops, when I have events, I ask you to tell people. The only reason I'm asking you to tell people is because this is who I am, and this is what I believe in, and I'm very passionate about it, because you can help the people around you. I mean, right now, I tell my family and my friends, everybody, and okay, once they tell me it's enough, I close my mouth. I mean, I had one of my best friends, both of his kids are on the spectrum.
What is spectrum?
Somewhere on the behavioral ADHD spectrum, undiagnosed, but somewhere along there. And they have looked into, should we do medication, should we do this, should we do that? And essentially, I had a question. I said, well, would you bring them to see me, bring the kids to see me? Or better yet, I'm too close. If I found you someone, would you go take them? And he said, no, my wife is not into this. I said, not into this? Clarify what this is. Well, she's not into alternatives. I said, I didn't say anything about alternative. I didn't say, I don't consider having something that's going to work an alternative. I said, if I can show you the research and bring you to a practitioner that's going to help alleviate pressure on their brain and nervous system and help allow them not to go on medication and make sure it's 100% safe for them, would your wife be into that? He said, maybe. I said, well, if you want an answer, then I can help you with that. But they really weren't into it. And after I put it like that, I wasn't going to push. So we went out to dinner with them, and they started talking about all the challenges they were having with their kid, and all the things that they were looking into, and maybe a medication. And I just sat there, and I listened, because I'd already said my piece. But people deserve to know some of this information. They deserve to know some of the new things that are coming out.
MindFit is a great experience if I had it. Under stress relaxes you completely. When you lay down on the chair, your body becomes weightless.
Yeah.
It helps you, I don't know, makes me sleepy. A couple of times I fell asleep, and after that session, 20 minutes, I feel like arrested.
Well,
And after when I woke, I said, well, I wish I would also sleep a little bit.
20 minutes
That's
on there.
exactly, I don't know how people, I wasn't also believer of that,
Mhm.
but you know. And
20
easy to-
minutes on there is 4 hours of restful sleep.
Exactly.
Between 3 and 4.
And also one more thing, because when I stress out, I have pains over here. Like
Yes.
most women have this.
Yes.
Like when I come, it's not MindFit. After the sessions, I feel absolutely relaxed muscle, no pain. It's
Right.
like lasted about 3 days after that. Of course, it's later on, it's my problem. Probably,
Yep.
but
Yeah. But
with negative thinking, probably. But
The
that-
tightness here and the pain
But it
here.
helps. It absolutely works.
The tightness and the pain that most people feel here is your brain trying to protect you. If your brain's under stress and your spine's starting to do this, your brain says, I don't like it, let's tighten up, and it tightens up all these muscles so that it's trying to protect you. That's when people get a massage and it feels good for 48 hours and then it all comes back.
Imagine I was absolutely not sleepy, and I was laughing at myself because I've upset a couple times I fell asleep.
Yeah. People, we have to go in there and kick them a little bit to wake up sometimes. So I'm going to open up for questions. The last thing I want to offer any of you, most of you under care, I know you've never been checked. Anybody that takes the time to come in here, I don't know if you need care. I don't know what your health is like. If you want to be checked for brain stress, for how your nervous system is working, Christina will book you in. It's on me. I appreciate your time coming here. I'm not going to charge anything if you want to come in and see what it's all about. I also open it up to anybody that comes to my workshops. If you have anybody that you know, just give Christina the name. You can either have them phone us, we'll phone them, it doesn't matter. It's on me. I just want to be able to expose people to this, and if they choose to come under care or they need care, then I can discuss it with them. If they don't, then at least it was an education for them. Does anybody have any questions about any of this?
I was very, very intrigued about the leap.
Yes, in Heartmath, yes.
What was the the magnetic field? No, it wasn't magnetic field.
The electromagnetic field of the Earth.
Right
Right now there's many outposts all around the planet that are monitoring the Earth's electromagnetic field, because the electromagnetic field of the Earth determines the sustainability of life on Earth. If the polarity of our electromagnetic field switched, there would be a catastrophic, our planet would not exist. So they're always monitoring it. So that's what they know.
I want to look it up.
Yeah, look up Heartmath. Heartmath is, they've got, this one's called Transforming Depression. They've also got Transforming Anxiety. They've got a whole bunch of them. I don't care if you suffer from any of these in a large degree, a minor degree, or not at all. It is such a great tool to learn, and it's much easier to learn when you are not under stress, or when you are not in massive symptoms. That's when you're going to learn this, so that when those things come up, you can neutralize it immediately. Anybody here that has not done the HRV testing with me, I'm happy to do it with you. And anybody that has done it, book a follow-up so that we can actually take it to the next level, because on the first time we just go through the basics, but there's sort of a deeper level that you go to, bringing in emotion, bringing in feeling, and how the emotion of love or gratitude can change things. Like in Heartmath, there's different levels, low, medium, high, and you want to get to a very coherent level because you feel it. When you're in coherence, you feel it. At the low level, you can get into a relatively coherent pattern just by breathing. Medium, you might need to breathe and visualize a little bit. In the high and highest, the only way you're getting into a coherent state is by bringing in an emotion. And when you're just getting good at it, it has to be a pure emotion. I would sit there in my bed almost hyperventilating because you want to make a change. When I'm trying to do what I've taught, but it was staying in the bad zone, and I was like, what am I doing wrong? And I'm trying to visualize. Then I picture myself hugging my kids. Green, immediately. I mean, it blew my mind, and that's what showed me the power of the emotion. I pictured lots of things I liked, but if you notice, a lot of things you like, there's always a negative to it, even if it's a relationship, but you might argue with that person, you love them, but you argue with them. The most pure love that I have is for my kids. And as soon as I thought about them, that was it, and it would go green. And it just taught me the power of emotion and how powerful it is for your heart and to get your brain and heart in rhythm with each other. So I encourage you to do your own research on some of this, to look into Heartmath, to explore the MindFit. Anybody that hasn't tried it, you're more than welcome to try it. It's more about introducing you to things that can help you out. Okay? Thank you very much. It's late, it's 20 to 9. Some of you are probably going to go home and go to bed like me, so you're back here in the morning. But if you have any questions about any